Hi everyone, I'm Dr. Ross Kopelman. Today I would like to discuss with you cosmetic procedures that are appropriate for people of darker skin tone. Now, whether you're Hispanic, Black, or Asian, I understand your frustration because there are many cosmetic procedures that are not appropriate for your skin that can actually cause damage. But there also happens to be some wonderful cosmetic procedures that do provide that enhancement that you're looking for. Whether you're trying to rejuvenate your skin, have a more youthful look to your skin, you want to be wrinkle-free, acne-free, you want to decrease the melasma around your face. So let's discuss the do's and don'ts when it comes to the cosmetic procedures for darker skin tones. So let's discuss some of the don'ts. First and foremost, avoid hydroquinone and phenolic acid. You might be tempted to pick up one of these creams to treat your melasma, but these creams can actually induce something called ochronosis, darkening of your skin. So when it comes to hydroquinone and phenolic acid, these are no-nos. When it comes to cosmetic laser treatments, cosmetic lasers have been used for decades to treat dark spots. But for people of color, laser treatments are no-nos. You want to avoid ablative lasers like CO2, erbium YAG laser. You want to avoid IPL, which is intense pulse light. And you also want to avoid ablative fractional lasers like Fraxel. And the reason for that is you can cause hyperpigmentation, which is actually darkening of the skin, or hypopigmentation, where you ruin the melanin that makes your skin who you are, and so your skin will actually become lighter. So the great news, though, is that there are advancements, and we see that there's some wonderful lasers that are coming out that will be appropriate for darker skin tones. Again, that's another video for another discussion at another time, and we will certainly dive into some of the leading technologies and the thought processes in terms of how laser treatments can be used to treat darker skin tones. But just to be protective of yourself, I would be very hesitant to jump into doing any of these types of laser treatments at the moment because we do not want to damage your skin. It would take a very long time. And in some cases, we would not be able to even repair the damage that are caused by some of these lasers to your skin if you have darker skin tones. Luckily, there are some wonderful procedures that can be used to increase collagen volume loss of your face, as well as wrinkles and acne scars. So these would include radiofrequency or ultrasound procedures, ultrasound specifically all therapy. And these procedures are used to tighten the skin. You can also use microneedling. Microneedling is great for any skin tone. It doesn't discriminate. And microneedling is wonderful to treat acne scars, wrinkles, scars on your face. There's a wonderful machine called Virtue RF, which actually combines microneedling and radiofrequency. It's one of the wonderful procedures that we have in our office, and I think it's become a very popular procedure that most dermatologists and plastic surgeons have in their practice. You can also do microdermabrasions, which are soft on the outer layer of the skin. And in terms of chemical peels for darker skin tones, a medium depth chemical peel would be appropriate. And melanin is protective against shielding you from photo damage from the sun, specifically UV light. However, I still strongly advise that you use a sunscreen or a suntan lotion. Now, I know you might not want to use zinc oxide or titanium dioxide because they can leave a white tint to the face. There are some wonderful tinted sunscreens out there that I strongly advise you wear when you're out in the sun. The reason for this is you're going to protect yourself against photo damage and also skin cancer. So don't forget to wear your tinted sunscreen when you go out in the sun. Another very popular cosmetic procedure that's appropriate for your skin is getting Botox injections or facial fillers or Kybella. All of these procedures are very safe in dark skin tones. Surgical procedures are still very safe for dark skin tones. Whether you're getting a brow lift, a nose job, you're getting blepharoplasty, which is cosmetic surgery of your eyelids. These procedures are very safe. However, when you have darker skin, we always have to keep in mind that you might develop darker scars from the surgery, and there's always a risk of developing keloids. Keloids can happen in darker skin tones, and so that's just something to keep in mind when you go for a surgical procedure. The wonderful thing about having darker skin is that you have melanin, and your skin is also thicker. So you are protected from the sun, you get less photo damage. So actually, it's very common to see an older individual who has darker skin, who still looks very young, because they got very little photo damage because of the melanin that protected them from the sun. Additionally, people of color have thicker skin, and so you tend to see less wrinkles on people who have darker skin tones. So keep smiling because you're still very, very beautiful. Regardless of the fact, the technology is getting better. And every day there are new procedures coming out that are going to really address the cosmetic needs of people who have darker skin. I hope you found this video informative. If you did, please subscribe to the channel. And if you have any questions about procedures that are appropriate for people who have darker skin, please leave them below. I look forward to seeing you in the next video.